Do you have pain with sex? But you also like to get down and you don't want to be told to not get down just because it's painful? Okay, well, this is a little video for you. Or for people who love people who are in this position. And I'm telling you, there's a lot of us, because even when I talk to people, and this more commonly happens with people with vulvas, okay? But when I talk to people in this boat, a lot of folks are like, yeah, I have that. It's normal. Trying to tell me, don't make a big deal out of it, whatever. We all kind of like go through this struggle. And while that may be many different reasons, anatomy, medical reasons for that, we don't actually have to suffer through it, certainly not without trying all the different things around it. So I'm going to focus on one thing today. I am Sexological Bodyworker. This month, I will be certified in STREAM, Scar Tissue Remediation, Education, and Management with Ellen Heed. It's phenomenal work, and it lets us know just how much many of us have scar tissue. Many, 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 many. If you got a vulva, if you've had childbirth, through the vaginal canal. If not, you're going to have it on your abdomen, most likely. You can get scar tissue from having penetration in your life without being sufficiently lubricated ahead of time. How many of us have been in that boat and have just gone along with it for whatever reasons, right? So there's medical procedures. I have scar tissue from 2 cyst removals and an ovary removal. There's many of us in that boat. And those of us with vulvas, many of you can attest to this, that doctors are quick to want to remove an organ without talking about the implications after the fact, not just of how long it's going to take you to heal, but that you will inevitably have scar tissue in your internal landscape after that. And if it's internal, no one has to see it. No one has to be like, oh, that was because of the procedure we did, right? But here's how this can affect us. And I'm going to speak specifically sexually how it can affect us. So scar tissue is wild, okay? Scar tissue is like, it forms, right? We have let me see if I can find one. Well, there's one on my forehead right here. We have scars that form to heal whatever the thing was. I ran into a wall when I was 2. And then all the immune system, everything works to get the thing repaired, right? It takes some time, but it repairs it. If that's internally, there's a different system around, because it's in a wet, moist environment. Yes, I said moist. Inside the body, there's going to be a different healing process. So depending on, let's say we have autoimmunity, which a lot of us do, the healing process is going to be different, maybe delayed, maybe an overabundance of healing, which is what just happened with a routine cervical procedure that I had, and my body overabundantly healed, meaning it's going to take longer for it to heal now, and there will be scar tissue involved that I will then need to work with, right? So scar tissue, just like on our outside skin, we can see that. But basically in the internal, you know how when your skin on the outside, if there's a scar, it all bunches up, kind of like, because it pulls in, because it needs to do all the things it's doing. It's going to pull in the tissue around it. Okay. So the same thing is happening inside your body. So let's say you had an ovarian cyst removed. There's going to be scar tissue that needs to happen for that to heal. And then it's going to start, because there's only so much tissue around it, when it pulls itself together to do the thing, it's going to be pulling on all the tissue around it. Yeah. When it pulls on all the tissue around it, that inevitably can involve sensitivity, like a hot spot. Scar tissue has its own network of nerves and its own blood supply. So when we feel like a sharp poke feeling, let's say internally, let's say you just gave birth and then you're like, okay, I'm going to try intercourse however many months after. And there's like at a certain spot, your scar can elicit that pain response just from being bumped, from being scraped against, from being jostled from its position, right? or even stretched because it's so bunched up in its little corner of wherever it's at, that it's like to rub up against that is irritating. So what do we do? This is in a massive nutshell right now. Scar tissue is complex. When we talk about endometriosis, which causes scar tissue, they've done like post-mortem autopsies or whatever on people where they're able to see like endometriosis that can travel up to the brain. Scar tissue, when we have things like leaky gut, when we're allergic to gluten. If you're allergic to gluten, your gut is constantly, and you continue to eat gluten, which many of us do, your gut is constantly having to like work hard at that procedure. Whether or not you believe in leaky gut or not, that means that like the tissues, everything around it are a little bit inflamed. Inflammation is like the common thing that we have with so many medical stuff that we got going on. Inflammation is going to change the viscosity of everything around it. It's going to make that scar tissue harder to just kind of resolve itself. And then it's going to get sticky and it turns it into adhesion. This is where I'm bringing in endo, because adhesion can then start to travel. Scar tissue moves along the fascial planes that we have running throughout our entire body system. And it kind of just moves along it. And so even if you have like a scar somewhere here in your abdomen, for say from a procedure like that, or endometriosis, this scar tissue, if it's sticky enough, can travel along these fascial planes. And in this example I'm using, they found that in someone's brain tissue, right? What happens when scar tissue gets so sticky and moves around the body that it starts to even create our posture, right? I can feel the scar tissue in my abdomen. It's like this kind of like a lumpy, hard, you might be able to feel certain spots that like have a little bit more like a ridge on them. You can feel like the difference around the things around it. Obviously, it's helpful if you know about where you had surgery or procedure or something to tell. But I can feel it in the abdomen from this procedure, and then it goes down into my leg. I can feel it in the crevice here. I can feel it going down, right? So it's already spread. Didn't stay in that one spot. I had 2 different cyst removals, one in my perineum, which I think spread both back and forward and down into the leg. If I didn't do this work, I wouldn't have known. No one talked to me after my procedures. No one was like, you're going to want to work with yourself in this way. And I do very much think this is related to the pain that I experience on the ongoing, because the scar tissue, again, has its own nervous system network, has got its own system of nerves happening there, that it's kind of giving out this input. And the scar tissue is inevitably being pressed by the things that already existed there. So scar tissue is trying to make its space in between the things or whatever. And it's like, my perineum's like, hey, we're like already like, we don't have no occupancy. We don't have space for you. So it's like, all right, I'll squeeze and like move into the leg over here, which I think is also affecting like this ability to move this leg and the blood flow. So what the heck do we do, right? Because if you're feeling the smallest, you might not relate to any of this, but if you feel the smallest twinge of discomfort, with intercourse, with anything sexual related, maybe with using the restroom, right? Because when we have scar tissue in certain places, it's going to make it harder for us to defecate, to get things out, because it's having to move past scar tissue. Okay. This is also a common one. And most doctors are not going to either know that or mention that. So if you're just feeling like there's like the sharpness or this fieriness, or there's not as much space as there used to be, or it seems like I need to be in a certain position and then it's okay, but in this other position, really not, that might be an indication that there's scar tissue at play. If you've ever had a procedure of any kind internally, and particularly when we're talking about pelvic stuff, because it's so common and this relates to the sexual work that I do, this might be at hand. Okay. So what do we do? try to find a sexological body worker who's trained in scar tissue work. Not all of us, because there's 5 different certified schools, not all of us got the same scar tissue work training. See if it's someone who's competent in that. So you can check, and I'll have the links here. You can check the Association of Certified Sexological Bodyworkers. I am the president of that right now. It's a volunteer position. I'm not getting any kickback for saying that, but you want to find someone who's proficient in it. Bonus, obviously, if they've been certified in Stream, if they've been certified through Ellen Heat, if you can find someone who's in that boat, maybe not even a sexological body worker, great. And if you just look that up, Stream, if someone's really certified, they should be listing that and highlighting that as a specialty of theirs. Great if you can find someone to work with. There's not going to be a bunch of us in all the areas. So if you can't, just know that you can do your own work. I do my own scar tissue work on myself. I did it earlier today. You might want to start with a scar that's not so loaded, maybe something external just to get the hang of it. And you want to use titration. Don't feel like it's go big or go home is not the goal here. Scars hold a lot of memory. If it's a medical procedure, you might have somatic recall. You might, something might arise of suddenly seeing the doctor's face right before you went under, or smelling, remembering what the space smelled like, right? This is not light work. It also doesn't have to be super heavy and scary. So I don't say that as an intimidation factor, just gentle, go in gently, with reverence. This scar has done such great work for you to stitch everything up in that area with that sensitivity and help you be able to be functional again. And it's going to remember some things, you can look this up. There's somatic recall. It's a real thing. So when I do scar tissue work with people and I'm working on a scar, they might have a sudden memory. They say it out loud and I ask them a question about it and they do go a little bit deeper with it and have this remembrance. I have felt scar tissue melt underneath my hands. Because in that moment, the scar is finding this thing that we were holding on to because we're already healed. The scar is already healed, right? It doesn't need to hold on to the thing. But the memory is what has not been, acknowledged. This was painful. This was traumatic. No one was, I didn't have the aftercare I needed, whatever it is, right? Sometimes just the remembrance. Then it can be now I can let go. And I've experienced this multiple times in working with other people. This is why I say there is a benefit if you can find someone to work with. I also do this with people online and they do their own scar tissue work and it still works. It might take a little bit longer. You might not have the same benefits of having a compassionate witness in the moment, but it still works. So I'm just going to show you because it's so simple. Let's say this little green line on the squash is a scar, right? Scars don't have to be big and massive and they can still be problematic if they're this small, okay? So first, the tenets of it are TLC, tender loving care, friction, heat. So just because it's tender loving care, it's a little bit of this is good for you, with your scar, you need to get some heat going on. If it's internal and you already have vaginal pain, for example, or internal pain of any kind, because you can also do this work intraanally. If you have any pain of any kind, again, it's not go hard. You do need a little bit of heat and friction and some but use your breath as you feel that, oh my God. See if you can breathe through it 2-3 times and just kind of, again, it's not go hard, okay? So the strokes, if you have 2 hands that you can utilize, you might also have a tool that you have that you love. The strokes are little fingers back and forth. So it's crisscross. Again, this might be easier to start with the scar on the outside, and you might even have someone you can work with you. It's like kitten. And again, if there's heat, if there's friction, you can really get going with something. Second one is going to be these little spirals. Okay. And the third one is really only if the scar is healed enough where it can actually starts to get some mobility again, and then you're going to pinch it. in between your fingers. But if it's like a stiff scar that you haven't worked on yet, and it's like, yeah, you're not going to be able to pinch anything. So do these other two first, and then you're going to start to see, oh, the scar is getting more elasticity. Now I might be able to do the thing, right? So again, you could try this on an external scar to be able to visually see how that changes. A little bit, maybe each day, a few minutes, maybe a couple times a week. I'm going to do 10, 15 minutes. There's no prescription for that as far as like experiment, see what works, watch, make notes on the signs. You're not doing this with dry skin. You're doing this with organic castor oil. I do not have a certain brand that I like, but it needs to be organic. Castor oil is like a magician. The castor plant is been around ancient. You can look up all the reasons of how it's been used. It's a major anti-inflammatory. And because the skin absorbs it so well, which is why we use it in Sexological Bodywork a lot, because it's so healing, you want it to be organic, because if your body's going to absorb it in, not only to the scar, but then to your organs, to your bloodstream, all the things, you don't want whatever chemicals they treated the castor plant with to now be in your system, because it really does suck it right up. Okay. For those of you who are need to see this, because that was a lot, I just wrote a blog that's going to go. These two are both going to be up on the website and social media for you to be able to access whichever one works for you. You can always reach out to me with questions. I would love to work with you if this is your situation, either from a distance or right now I'm in Portugal. And also we'll be coming back to Michigan, here and there. So yeah, if this is your situation, let's talk, because there's relief. So this is going to be a series because there's so many reasons why you could have internal pain, why you could have pain with sex. There's so many tools that you can do for that, whether or not it's basics like positioning or finding accessible toys. There's so many things, but this is where I want to start, because not only is it a passion, but I see how effective it is. And if this underlying very physical thing is impacting you in this way, and you can get relief within a couple months or something, with a little bit of practice and experimentation, why the heck not? So please leave your comments below if you try this and you have questions, or you want to give feedback, or it works for you, because that might encourage other people to give it a try as well. And yeah, I wish you all the best in it. I love this work. I don't know your body, and I love your body, and I hope you find relief.